My name's Leanne Asprey. I'm a cognitive behavioural therapist and coach. And on this channel, I aim to educate, inspire, and support you with regards to your mental health and how cognitive behavioural therapy can help with this. Now, this particular video is one that aims to inspire because it was recorded with one of my previous clients who made such great progress using cognitive behavioural therapy that she wanted to share her story so that she could give hope to anyone else who is experiencing similar difficulties. So I really do hope that if you can relate to this story, that you know help is out there and that you can see that there's light at the end of the tunnel.
Good evening, everyone, and welcome to this evening's live, where I'm going to be joined by the lovely Sian, who is one of my previous clients, and she's going to come on this evening to share her story with you and hopefully inspire and motivate anyone who may be experiencing difficulties with their mental health to reach out for some help. So I'm just going to wait for Sian to join. There we go. We got there eventually.
Sorted.
Yeah, it's just a bit slow. So how are you? Welcome.
I'm all right. How are you?
Yes, I'm really good, thank you. So thank you for obviously agreeing to do this. I'm sure this is going to be so helpful for anybody who is struggling and can't quite decide on whether or not they want to kind of reach out for some help. So should we start by you just introducing yourself and telling people a little bit about who you are and what you do, maybe? Maybe a good place to start.
Yeah. So my name's Sian. That's been covered. I'm 25 and didn't realise it, but I've been suffering from OCD since I was about 5 years old. I think was the time we kind of pinpointed it back to. I'd been struggling for a long time. I'd been through numerous counsellors, doctors, life coaches, and then sort of December time, with COVID and all the lockdowns and everything, I realised one day when I was just driving that I'd had enough of what was going on in my head and not being able to take a breath. And so that's when I got in contact with Leanne. Had a few, was it about 5 months of sessions?
Yeah, it was about 5 months, yeah.
So it's been a few months now since we last spoke. Yeah, so it was mad to think that what had been 20 years was within 6 months. I completely not only understood OCD, but I also completely understood myself in a way that I'd never had before. So yeah, it was I found it really interesting, but it was also very life-changing.
Yeah, you've made huge progress, haven't you? It was so lovely to see the progress that you made. So first of all, kind of what led you to decide to reach out for CBT? Because I know you said that you tried loads of counselling before, and counselling and CBT are very different, aren't they? So yes. What kind of made you decide on trying CBT?
Well, when I went through counselling at high school, then at college, and then I went into it again at uni, and it was a counsellor there who stopped me and said, "Do you think you've got OCD?" And that's when I went to doctors and I got medication and all kinds. And the counsellors were great. You know, they helped me to pinpoint exactly what trauma it led to. Sort of, they helped me because I was all pent up with pain, and it wasn't until I spoke to the counsellors that I started to realise I could talk about it, and it got it off my chest, which was fine. You know, it got to the point, you know, this counsellor noticed it, but that was it. There was no, but how do I live with that? What are the tactics? And then when I was doing my teacher training degree, a doctor suggested CBT, right. But the waiting list was incredibly long. And then as I moved out of the area and moved back home, I came off the waiting list. But I always knew that it was more therapy I needed than sort of counselling, because I knew what the problem was. I just needed to be given the tools to deal with it.
Yeah, so that is the difference, isn't it, between counselling and therapy? I think it's for anyone who's unsure. Counselling, obviously, it is very useful and it can be life-changing for many people. But CBT it gives you them tools, doesn't it? It gives you the strategies to actually put in place in your life for change to start to happen. When you understand what your problem is and you kind of understand the root of it, it's then kind of saying, well, okay, what do I need to do then to get me where I want to be? And that's, I think, what CBT is so good for. It says, right, this is why you're feeling like you are, behaving like you are, thinking like you are, and this is what we need to do to kind of get you past that. So
yeah,
so that's
it was kind of like being in sort of a dark room, and the counsellor sort of guided me to a pinpoint of light so I could see what the issue was.
Yeah.
But those still obstacles, I still couldn't get to it. And the CBT is sort of the scientific method of just giving you strategies and tactics, and just to completely understand what it is that's causing it.
Yeah, absolutely.
So,
and you mentioned that obviously the waiting list was quite long for the NHS, which sadly is true. How easy did you find it to find a private therapist once you decided to go private? How easy or hard was that for you?
in terms of listings, it was pretty easy. Just a search engine, little search. But I did find it quite helpful going onto people's websites and seeing reviews and things like that, and finding somebody pretty local. But no, there's definitely there's an abundance out there. But I also found it I did find it quite nice to find somebody who was within the sort of same area, so that it was, and obviously on search engines you can do that quite easily.
Yeah.
So yeah, it wasn't too hard.
And also as well, you had online therapy with me, didn't you? You opted to have it online. So I suppose for anyone else as well watching, because coronavirus has changed the way a lot of things happen, and I know that I've got many more online clients than ever before. What was your experience of online therapy? Do you know, well, I think the fact that you got great results speaks for itself, but what was your experience? Did you find it any different to face-to-face? What were the pros and cons?
I worried that it was going to be like a bit cold, and it would be a bit strange, because essentially, you sat, as I am now, just sat talking in a room. And obviously there's the added thing of the fact that you're in a room, but there might be other people in the house who are also listening or are about. But it kind of within 10 minutes it felt completely at ease, and in some regards I always found it quite uncomfortable, or a little bit too intimate, a little bit intimidating because of that, when I was in person with any counsellors. Right. And I'm sure that would have been completely, again, within 10 minutes would have been fine, but it actually made me feel a little less anxious, the fact that it was online. So I think the fact that that's now an option is really good for those who do get nervous leading up to a session.
Yeah, there's definitely some pros, isn't there? And I find as a therapist that I do get the exact same outcomes for clients online. So for anyone who's watching who, is a bit concerned about doing it online, you will get, the results. It's all down to obviously your home situation and whether you've got some privacy at home, because I know not everybody has privacy at home, and you obviously need that privacy for therapy. So yeah, but the results can be just as effective. So the next question was, how difficult did you find it opening up to a stranger? Because, when you go for therapy, that first session, it is very much, you never met me before, and I ask you loads of questions, and you've got to kind of tell me some of the really deepest things that you've probably not shared with anyone before. How difficult was that?
It's odd, because you think it's going to be really hard, but ultimately, when you've contacted that person and they've taken you on, they've got your best interests at heart, and it's actually easier in some respects to talk to somebody who's detached. So somebody who's not involved in the everyday, somebody who you may even be talking about. I often, even with just general counselling, I often found it much easier to talk to them, because knew there wouldn't be any backlash. There would be no personal feelings involved or any like hurt or injury. I've always found that I've actually found it much easier, the whole pouring your life story out to a stranger kind of. But particularly, I found it particularly easy to carry on that as soon as I would tell a small snippet, you would ask me a question that would straight away make me stop and think, she's completely understood what I've said without me having to talk around it, without there being an argument, without there being miscommunication. So it's comforting when you also know that that person, one, experienced people with like you, and two, it completely understands without you having to over explain.
Okay, great. That's really nice to hear, actually. And with regards to OCD, and obviously for anyone who doesn't know what OCD is, obsessive compulsive disorder, it's an anxiety, it's a form of anxiety. What did you, before you came for CBT, what was your understanding of what was going on, and kind of what a CBT helped you to understand? What's the different relationship now you have with that?
Well, it's completely redefined what OCD is to me. You know, most people's conception and perceptions of OCD is what you see in films, you know, as people oh, it's just me OCD playing up, or I'm just a little bit OCD, when often it just tends to be perfectionists, or it tends to be just organised. You know, you might like to keep things straight and uniform on your shelf. That's just being neat and tidy. So as soon as when I was told I had OCD, it was a little bit like, I feel like I'm in a much worse way, and that can't be right, because in my head OCD was something really minor. It was just that I liked things to be in order.
Right. Okay. And
So,
you think you got that perception from society?
oh yeah, films, all kinds of, you know, everybody says it. Everybody's like, oh well, you know, I'm a little bit OCD.
Yeah.
And you just think it's just a way of describing. You never break it down as obviously as obsessive compulsive disorder. You know, it's the same level as bipolar or attention deficit disorder. Like, it's a mental disorder, but you don't think of it like that. So I just always presumed I was compulsive. I liked things to be a certain way. I would do certain things, but again, I never really acknowledged it, and it wasn't until we started to, not only obviously after we'd done the session of me talking about me, it was talking about what actually is OCD, and that actually the obsession bit isn't the big bit, it's the compulsion bit. And it completely changed my perception of the fact that it's not a case of, oh, I obsess over things, you know, I fixate. If I've read a book, I fixate completely on it. Well, no, it's the compulsion side of things that's completely dictates your life. And yeah, it's made me take it a lot more seriously, but also be kinder to myself in regards to it.
Okay. So for anyone watching, do you want to tell them a little bit about what your OCD was, how it presented in your life,
Yeah.
and what kind of things it was?
So I've got, responsibility OCD, which means that basically I take responsibility for everything that surrounds me, including every aspect of every person's life. So, you know, if I take friend A, their relationship status, if something goes wrong or something is not quite right, I have to pick up the pieces. I am responsible. If they are out of work and are short of money, I will find a way to fix that, because I am responsible of keeping them happy. And obviously along with responsibility comes guilt, blame, So if they're unhappy, it's my fault, and so I have to do whatever I can to make sure they are happy at the expense of myself. And it wasn't until we were talking that I realised that I had never spent any time on me.
You hadn't, had you? Never.
No, and it was insane to think about, because I used to love to read when I was younger, and I would often think, oh, after work tonight, I'm just going to curl up with my book. And my mind would just straight away go, that's not time well spent. There's no value in that. Surely there's something you could be doing to help someone. You know, whether it be that I'd sit there and literally do nothing, just in case somebody messaged me and said, I want to play a game tonight, will you join me? Yeah. Or I'd be like, oh, I kind of want to play a game on my own, but I wouldn't ever bother to start the game, because I knew that if I started it and somebody messaged me and said, I need you, I'd have to stop it. So what was the point in even starting it? So I'd often find myself, I lived for other people, and there was nothing I ever did for me. Like when we went out, I would dress in a way that I knew they wouldn't be embarrassed about. I knew that I was seen as the loudmouth, sarcastic friend, and so I would never slip out of that role. I knew that I was the plain Jane, so I would never do anything different with my hair, and never wear bright colours, or never really mix up my jewellery or anything like that. And like, I knew, for example, it was basically my biggest fear through everything we went through together, from my backstory, was that I would be a bad person. And my OCD, my brain, became fixated in making sure I redeemed myself, in making sure that I was not a bad person. So everything I did had a worthwhile benefit, but never for me. I never gave my own opinion, because I never wanted to tip the balance in an argument. I would always take the underdog's side if I had to, because then it would be even. There were so many things, like I would be so terrified of upsetting my friends that even if there was something we did that I didn't enjoy, I would just do it, because for me, I was happy when they were happy. But actually, what was the case is that, whereas some people think of OCD and they think, oh, somebody has to flick a light switch 8 times and then whatever they've been thinking about doesn't happen. For me, it was a case of something much bigger, in that my friends would have a problem, I would fix it, and they'd be happy, and that would satisfy me. That was my compulsion. Doing the kind thing was my compulsion. And it just was an endless cycle, until the point that day when I had to pull over in my car, because I just couldn't. A lot of people always say, like, oh, have you got anxiety and depression, but the two are so completely different. And I always say, like, depression's like being in a complete empty cavern where there's no noise, no light, it's just completely nothingness. But anxiety is it's like being in a room with 100 radios going off at the same time, arguing to be the louder frequency, and it's just constant. And that day, it just became too much. And I think that's important to know the difference. But it's just a very high form of anxiety, and it was a lot.
The radio frequency that you've just described, I've had a few clients describe anxiety, like an OCD related anxiety, exactly the same. It's just radio that you can never turn off, and there's like loads of different radios going off at once, and there's just no way of shutting them off. So you can just imagine what that's like.
Yeah. You know, wasn't sleeping, because it'd be like I'd spend all the waking hours of the day helping others, and then I'd have tasks that I needed to do, and I needed to finish them because, again, I was obsessed. So I'd do that through the night, and it was killing me. I was exhausted. You know, led to, over the years I've had panic attacks, and you can't have OCD without anxiety, and it's just a completely heightened form that I do think needs to be known more about, rather than it just being, oh, I like having my ruler sat perpendicular to the edge of my desk at school.
Yeah, there's many different forms of OCD, isn't it? But yeah, like you say, the media present it as being a lot to do with germs and having to count certain numbers. But yeah, there's many different forms. So you mentioned then that your OCD was kind of caused by this fear of being a bad person, and that's obviously something that we kind of identified in your session. So for anyone kind of watching, how based on what you've learned in CBT, what do you now understand about when someone has this fear, this belief about themselves, how their brain then protects them from it to the point where it creates the negative thoughts that we spoke about, which obviously obsessions are the negative thoughts that you were having. How would you explain to somebody who's watching how your brain was dealing with that, really?
So I think one of the things I found most interesting in our sessions was the fact that your brain is essentially a muscle. It's a tool, and like a computer, you feed it information. And if you become so scared of something, how is it to know the difference between something that is genuinely something to be scared of, such as about to be hit by a car or a wild animal, or if you're feeding it the same fear, how does it know that spiders or clowns or heights aren't any different? Because it only knows what you tell it.
Yeah.
And I found it so interesting that I had, obviously subconsciously, and because I'd been told it from a young age, or at least believed it from a young age, I'd convinced my brain that being a bad person was as life-threatening, as survival ending, as being trampled by an elephant or being struck by lightning. I managed to convince, and now, so I was always so angry, always so upset with myself and my mind. And, you find yourself sat there going, why are you thinking like this? Even just physically pounding yourself in the head, like, when actually, when you look at it that way, you realise that actually your brain's trying to protect you. It's making you do the complete opposite because it thinks it's a genuine fear. In the same way as if you saw something physical, it would make you run, the flight. It was making me, and I found that incredibly fascinating, that actually I needed to be more patient and more just kinder to myself, because actually it wasn't known. My brain wasn't to know, and that's the moment when we started to talk about things, that I started to verbalise stuff I'd been thinking I'd never said before. And I'd say something like, well, I can't say no to my friends. What if they've asked me to game, so I have to drop everything, so that I've got to try and arrange it, or this person wants to do this, but my mum also wants to go for a dog walk. I'm going to have to find a way to balance it because I can't say no to either of them. And the one time I turned around to my friends with the support that came from these sessions, and I said to my friend, I'm not going to be able to game tonight. I'm going to get into bed and watch some TV instead. I was terrified, because to me that was bad person, and to my brain that's death. It was like a danger.
Yeah.
And my friend just went, yeah, all right, that sounds nice. and it completely
not what you were expecting.
and you know, by the third session I found myself going, as we went through, and you would say things like, obviously, you know, if you make time for yourself, that makes you a bad person, doesn't it? And I'd go, when you say it, it sounds ridiculous. Like, no, I want my own time. And how can I make everybody happy all of the time? If I have to do that before me, I'm never going to get to me. I'll never read the books.
And it's just hearing somebody actually ask you them questions
Yeah,
that makes your brain look at it differently, doesn't it?
when somebody says it, you think, did I genuinely believe that? Because that seems ridiculous. And one of the things we did in CBT is I had to write all of these rules that my brain had made for me. Don't do this, don't do that, and what I assumed it would mean. And usually it led to being a bad person. And I've had them on the fridge for months now. And
They're
I
still
look at them,
there.
yeah. And I look at them now and I go, I can't imagine ever genuinely believing that.
Have you got rid of them all now? Are they all gone?
They're all pretty much.
Wow.
Don't get me wrong, there's certain days, and there always will be, and there are times when I get shaky, and I start to question myself. But I read through them like, you know, I need to dress according to my stereotype, because people will be embarrassed by me. People will want to stay away from me. My family will make comments. I don't care. Like,
So you
and
are
it
back now.
just, yeah, it makes me feel like a right rebel. But it's it definitely taught me.
Freeing.
Yes, completely. And I a much better understanding of myself. And like I say, it's taught me to be much kinder and gentler with my own mental health, rather than just being so angry. But yeah.
Kinder to you, because you never had a problem with being kind. That was obviously, you were very kind, but not to yourself, and that was
Yes.
the problem, wasn't it?
Yeah, but for me, I didn't matter. It didn't matter.
No, you didn't.
I only existed for others. You know, it was even in my darkest moments when I was in uni, and I felt absolutely, when my anxiety did partner up with depression, and I spoke to my mum about it, and she looked at me all teary and she said, you know, would you ever do something to hurt yourself?
Oh.
And it terrified me, because I wouldn't want to do that, because I wouldn't want to hurt them. And even in that moment, when I was at my lowest, my OCD was still taking responsibility. It was like, well, you could never do anything to yourself, because that would upset them, and you only live for them.
Right.
And so but again, you don't notice that until somebody says to you, have you considered this way of thinking? Because you are stuck in old habits. You're stuck in a certain way.
What do you now know about thoughts then, for anyone watching? Because obviously negative thoughts are a big part. I always say, like, everyone I work with, whether they've got anxiety, OCD, depression, everyone I work with, the one thing they all have in common is they are having negative thoughts and believing them to be true, and then that creates the feeling. So what do you now, for anyone watching, how would you describe negative thoughts? Because you used to obviously believe them to be true, which is why you carried out the compulsions. What do you now know about negative thoughts?
I know that they are there to guide me, in that they're telling me something I don't want to happen. So, you know, before it'd be a case of, they sound ridiculous when you say them out loud, but you know, it'd be a case of I'd be in the shower, and I'd get to the end of the shower and I need to like squeegee down the glass, and I'd think, oh, I can't be bothered, but then I've got to, because if I don't do it, a member of my family or my friends will be in a car accident and die. And as soon as that thought appeared in my head, it was like, that's ridiculous. How can I dictate whether they get into a car accident? But just in case, I'm going to squeegee the shower.
Yeah.
And it became, every time I felt good afterwards, but it was just like a mini relief, because as soon as the next thought came, I'd convinced myself that had helped, so I'd do it again.
Yeah.
Whereas now I know, if that thought comes to me, it's again my brain trying to protect me and saying, don't you want to do this because you don't want them to die? And I go, well, no, I don't, but I don't need to do that in order for it to not happen.
Brilliant.
So yeah, I know now that your negative thoughts are just your opposite of your positive thoughts, quite literally.
Yeah, your brain's reminding you of what you don't want to have happen, isn't it? Yeah.
Yeah.
Not facts.
Yeah. So it frequently is a bit like, why have you brought that up now? Like, you know, you're about to drop asleep and your brain says something like, you know, someone could break into their house and murder your family. And you're like, before, whereas that would like completely panic me, now I'm like, well, yes, I don't want that to happen, but can you shut up? I'm trying to go to sleep. It's more just like an irritating little friend on my shoulder who, when I'm tired or when I've had a sort of an emotionally draining day, can chirp up.
Yeah,
as all people's thoughts can. We all
absolutely.
have
if we're tired or we're not feeling very well, yeah, we do. You know, we do tend to notice that we're
because
less
you're
tolerant.
naturally heightened and panicked. So yeah, well, I will. Yeah. That's when things start to dwell on my mind. But now, I have the tool to actually go, I know what you're trying to say. I accept that you're worried, but I'm going to go to sleep.
And you do. Brilliant.
Yes.
Yeah, so if we don't, our thoughts, unless we give them our attention, they don't have any power over us, do they? I know they don't feel like that for people, but you know, if we believe our thoughts to be true and we give them the attention that they're wanting, that creates the feeling, then that creates the behavior. So, you know, if we don't give thoughts our attention, they don't have any power over us. But it's a skill, like you say, it's not something that's happened overnight with you, is it? You've had to do the work, and I think understanding it as well, isn't it? I think CBT for me, as someone who kind of used it herself and now obviously does it as a career, it's educational, isn't it? Like, we're not educated enough about how our minds work, and if we don't know how something works, how are we supposed to know what to do to move past these difficult situations? So that's the one thing I love about CBT, is it's so educational. I see with my clients, and I saw it with you numerous times, like light bulb moments going off in people's heads. It's like I say something and straight away I see this switch happen, and they're like, oh man, never thought of it like that. And then that's when change really starts to happen, because you get a different perspective on something that you've never understood before.
Especially if you have OCD. Generally, it tends to be, one thing we have in common is that people with OCD are analytical. They overanalyze and they're logical. So to be told how something works suddenly makes the problem, rather than something completely unfathomable and it being completely mental based, and it's the muscle of your brain and you can suddenly work with it, and it just makes it all the more accessible, I think, which is one of the things I did like about CBT, because I like to learn in general, but that was particularly, it wasn't wishy-washy. It was completely, this is what your brain's doing, this is why, and this is how you combat it. And it was like, oh, and it made complete sense.
Yeah, it does, doesn't it? It really does. It really does. So what can you now do that you couldn't do before then, Sean? How's life different for you now?
Well, I dyed my hair.
I remember you doing that when we were having our sessions, because you'd never ever done anything for yourself, had you, before, or changed yourself?
I dyed it in high school, when I got to a point where I wanted change to happen, but it never felt comfortable. But yeah, that was my biggie. I've started to buy things that I'm genuinely interested in and no way bothered about the backlash.
Good.
I've gotten back into interests that I've always had that weren't necessarily, that I was always scared would come under criticism. So, you know, I would, the things I've loved for ages, but I've always sort of kept on a simmer because I was afraid people would go, why, what, why are you? I've completely embraced, I would say.
Good.
You know, I spend a lot of time doing what I want to do. Don't necessarily read as much as I would like, but that's because I've got quite a busy job at the moment. But I have read a number of books in the last few months.
Good.
And bearing in mind it was taking me 18 months to read one, I've read at least 12 maybe since we last spoke.
No way.
Yeah.
Wow. That's impressive.
And I found complete joy in them as well. It wasn't a case of I've got this many books that I haven't read and I need to work through them methodically in order to take them off my list. You know, there's one that I have talked so much about to my friends that one of them has lent it off me, borrowed it off me, and then another one has gone away and read it themselves. I've watched TV programs that have been sat waiting to be watched for a long time, and I've spent a lot of time playing my own games. I went on holiday last week, for example, and there were a few times that there was 8 of us, so there was a lot, and I don't know if any of them are watching, but a number of my family members have some very big personalities, and it can get a little bit suffocating at times. And whereas normally I would have stuck to it to a point where I may have even gone into a panic attack because I was so overwhelmed, I knew I needed to be present. This time, when it started to get a bit too much, just went off to my room, had a soak in the bath, watched some TV, read my book in my own company, and I did not once feel a pang of, oh my God, I'm not attending my duties, I'm not downstairs, I'm not keeping everyone's attention, I'm not keeping the conversation going. I actually was more than happy to remove myself and just take a bit of me time, call it a night early so I could go have some, and it was completely, one of the days I'd hurt my leg when we were out walking, and rather than push through it because my mum wanted to go on a big family walk, I said, you go, I'll stay at home. And
normally you would push through it to go.
No, the idea just completely, because I could have missed out on something that I needed to help with.
Right.
And it didn't in any way faze me. I was like, what's my holiday too?
Good for you. And have your family members kind of noticed a big difference in you? Have any of them kind of commented on how different you are?
Well, my mum was very present during the therapy sessions, and so she noticed it as we went. I have occasionally I see her tearing up because I've done something that she's gone because she's so amazed. But I know my dad's noticed. He never comments on it to me, but he does. I know he mentions stuff to my mum, in that he has noticed a change in me, that I'm much more comfortable in my own presence as well as other people's, and a number of my friends have said it as well. So I think initially it was something where they were like, this is new. But even now when I do certain things, they do look at me a bit like either out of pride or a little bit of shock. But it's this version, this sort of learning to live with OCD version of myself is becoming the norm now. which is nice.
What does the future hold for you then, now that you're in this position?
Oh, well, somewhat limited by the pandemic.
Well, yeah. Unfortunately.
Yes, I definitely have plans to go and do my masters, which everyone always said that I should, because I've already got 2/3 of an education masters. It's logical to go and do that instead, but I didn't enjoy doing education, whereas I want to do a masters in history, so I will go and do the masters I want to do. That's definitely going to be done at some point when I can attend uni as things were. I'm much more. My job has been extended.
Oh, brilliant!
But I've got a completely different outlook on it. That I don't take it too seriously. I don't bring it home. I don't carry it on my shoulders, and will quite happily tell my boss when he is putting too much on me. Whereas before, obviously, I'd make myself ill in an effort to just keep. And yeah, I think it's just the future will just be continued progression.
Yeah, it is. It's not something that, even though you've got all these tools and you're already making amazing progress, it's continuing to use them, isn't it, to keep making progress and keep working on you and that relationship with yourself. It's so important you keep doing that, isn't it?
It's not something that you can, got an infection and you take some antibiotics for it. It's a disorder that it stays. But yeah, it's learning how to cope and how to manage it, and being able to understand it straight away changes your outlook, because I am much kinder with myself, much more patient, and much more understanding in things that I do. And because I've been able to do that, I've been able to tell my friends and my family, who are then therefore more understanding and much more intuitive with me. And it just makes life so much easier in every aspect.
Yeah, you seem so much happier. So for anyone kind of watching who may be, experiencing anxiety, OCD, any problems with their mental health, and what would you say to them with regards to reaching out for help, CBT, the techniques in CBT as well? Because I obviously, because I wanted to help people who can't access therapy or don't want to access therapy, because not everybody wants to, I've developed the CBT online hub where I share the techniques. So what would you kind of say to people about therapy and even just the techniques in CBT, and how they can be so kind of life-changing if you understand the mind, and how they can help you to change things? What would you say to anyone watching?
I would say that when your car isn't running well and a light comes on and you don't know what to do about it, you take it to somebody who knows the car inside out, and they give you oil, they give you a manual, they give you the tools to fix or smooth out the problem until it's running fine again. And I would say that it's the same again, and that you go to the therapist, you go to the online hub as you would the mechanic, and the techniques don't necessarily fix the problem for good, but they smooth it. They give you a way of still running, still working on the engine. It's the techniques are based on knowledge. It's not a case of, oh, lie here in this reclined chair and I'll write in my notepad. It's a case of giving yourself an MOT. It's checking in. It's using exercises in the same way that you would exercise a muscle, because your brain is a muscle. It's in many ways, it's like physiotherapy. Once something's broken, or dislocated, you tend to have to continue with those physiotherapy exercises for the rest of your life. Sometimes they take 5 minutes in the morning, sometimes on certain days when you're feeling a bit worse for wear, it might take an hour. But the exercises are there, and when done, they make things easier. And I would say, yeah, that CBT is essentially just like the after physiotherapy for your brain.
I like that. That's quite a good way of looking at it, isn't it? Yeah, because I still, now, even though, you know, I'm in a much better place with my mental health, I still practice things every day. I do my gratitude every day. I do meditation. You know, it's just something that no, I don't need to do it. I want to do it, and I just know that doing it is going to keep helping me. And, you know, it's just something that you then it becomes ingrained in you to do these things. So I imagine that's happening with you now, that you've got this bit of a, you know, routine, and you're starting to kind of question when certain old patterns creep back in, and you're very quick because you've got the tools there that you can say, no, actually, that's not going to happen today. So yeah, but it's having them tools. If you don't have them, you can't do that, can you?
No,
so
it's about having them, and also having the awareness that you need them. You know, before I didn't know I needed. I thought it was norm. I thought that was, and it wasn't until, you know, you lay out with these tools in front of you that you go, actually, I do need them, and for this instance, I need that one. And, you know, it's just arming yourself against negative thoughts.
Reprograms your brain, doesn't it?
Yeah, it completely makes you rethink everything you've previously thought.
Yeah, which is so empowering. So empowering.
Yes,
yeah,
definitely.
Okay, so if anybody who's watching has got any questions for Sean, let me just have a look if anyone has got any questions, please do. That's you. If anyone's got any questions, just put them in the box. I haven't got a very good view of questions. They seem a little bit the thing seems so if just kind of finally then, if you hadn't reached out for help, where do you feel like you might be now? Like, do you ever think about that?
Not really. I think if I did, if I think about it, I probably would have just been carrying on, because I was stuck in a continuous loop. You know,
just carrying on struggling.
Yeah, there was no breaking from it, because I wasn't aware there was anything that needed to be broken away from.
So did you just think it was normal? Is that what you believe back then? Yeah.
I genuinely thought my outlook was okay, and I thought I had different priorities than some people, but I generally thought my outlook was average. I thought it was the same. I never understood, you know, it would get to times where I would be heartbroken by the actions of friends, because I'd be like, I'd do it for them. Why do they not care as much about me as I do them? When actually that was very unfair, because they cared about me 100%. It was just a case that I was caring too much. I was caring at 150%.
You weren't allowing them to care, to show how much they cared, were they? Which was another part of your problem, wasn't it? And the problem for many people I work with is that these behaviours that people put in place to protect them, it does stop them from ever seeing how much they are valued for by other people, because you were always there. I'll do it for you, you're not allowed to do it for me. So that kind of made you kind of think that your people only liked you or valued you because of what you did for them, rather than who you were. And I think I remember you saying to me during one of our sessions, I think you'd kind of asked one of your friends to do something and they were really happy to do it, and you were a bit like, you were just shocked that someone cared about you that much, because you'd never allowed them to show that before. And this is another problem with, you know, OCD and anxiety and depression. We put up this wall which stops us from ever seeing just how important we are to people.
Yeah.
And we take that wall down, and it's just such an amazing experience because you start to see yourself differently. It's lovely, isn't it? You see
Yeah.
the world so differently.
I always saw I always wanted them to be dependent on me because I didn't allow them any other choice, but I would never be dependent on them because I felt like I was adding to their problems, and obviously their problems were my responsibility. And but yeah, the moment when they stepped up for me because I allowed them to, it was the greatest high, much better than any obsession ever could have. It was in that moment I realized that for the last how many years I'd only fed off other people's happiness. I hadn't experienced it for myself.
And what does it feel like to experience it?
It's very, very nice.
Brilliant.
Yeah, it's not like second-hand happiness anymore. It's content.
Good. Mel's just said, I just wanted to thank you for sharing your story. I've got terrible eyesight. I've been very... Can you read that better than me? I've not got my glasses on.
It says, I just want to say thank you for sharing your story. It has been very insightful and have lots of food for thought coming from this.
Oh, lovely. Thanks for that, Mel. Yeah, so brilliant. So thank you so much, Sean. I've got no doubt that anybody watching it, will feel massively inspired by you, because I think, there is so much stigma around mental health, and I think when people like yourself, are willing to open up about it and, share your story and let people see that you can get past these difficult times, it's just so inspiring and motivating for other people. So thank you so much. Even if we've just helped one person today, that's, that it's been absolutely worthwhile. Okay.
Yeah.
So
if I could help one me, yeah, I'm more than happy.
It's worth It's worth doing it just for that one reason, isn't it? So thank you so much. And we are live again on Thursday on Facebook for anybody because I know a lot of my audience aren't on Instagram, so we've agreed to do one on Thursday as well. So I will see you then, and thank you so much.
It's okay. Enjoy the rest of your evening.
And you take care.
Bye.
Bye.
So I really do hope you found this video to be useful, and if you could relate to the story that was shared, I hope you're leaving here feeling inspired and know that these things can be overcome with the right support. Don't forget to like and subscribe so you can keep up to date with any future videos that I put on here. And if you want more information about cognitive behavioural therapy, take a look at the link below, and any questions, please do get in touch.